Welcome. Hello, I'm Krupal Patel, Assistant Professor, Division of Head and Neck Surgery, City of Hope Comprehensive Cancer Center here in Los Angeles. I'm pleased to moderate this webinar, Beyond Appearance, Body Image, and After Head and Neck Cancer. Thank you for joining. This is an exciting topic, and this is the first time that the Head and Neck Cancer Alliance is presenting on this. Treatment for head and neck cancer can significantly change how survivors see themselves, both physically and emotionally. This webinar brings together clinical experts and a survivor voice to explore how these changes affect body image, self-esteem, and day-to-day confidence. Together, they'll share perspectives, strategies, and encouragement to help survivors navigate these shifts and move towards greater acceptance, resilience, and healing. Thank you for joining us for this open, supportive, and empowering conversation. Just a reminder, this webinar will also be recorded for those of you who may need to leave early, and it will be available through the Head and Neck Cancer Alliance website. You're welcome to ask questions either by chat or the Q&A function throughout the webinar. We will address them at the end of our session. There will also be a survey for you to provide us some feedback on our webinar. I'd like to introduce our next presenter and get right into it, our Alliance Ambassador, Mr. Terry Healy. Terry is an author, professional speaker, business strategist, and a survivor of a rare maxillary fibrosarcoma. His journey started at the age of 20 when Terry was diagnosed with a malignant maxillary tumor. Over the following year, he underwent multiple surgeries, including one that required removing part of his nose to save his life. After surgery, Terry felt vulnerable and exposed. He endured countless uncomfortable stares, and his self-esteem suffered further during the 6,000 rads of daily radiation and 48 hours of the iridium seed brachytherapy implants, which shrank his facial tissue and further intensified his facial changes. Despite these challenges, Terry's journey has become one of discovery, resilience, and a commitment to helping others navigate such a serious diagnosis and the changes that come with it. Terry, the floor is yours.
Thanks, Dr. Patel, for the nice introduction. I'm Terry Healy, and first off, I want to thank everybody for joining today's webinar. It is a real honor and a privilege for me to get the opportunity to share my survival story with all of you today. So my story dates back to about 1980 when I was in high school, and I was really living this life on easy street because I was getting good grades, I was an athlete, and this is back in the days when our basketball shorts were too tight, our tube socks too high. I was even a homecoming prince, and you're probably giggling about those hairstyles. I swear that was the thing back then. And I graduated from high school having saved enough money to pay my way through my first year at UC Berkeley. And that life on Easy Street continued for me right up through my junior year at Cal when I noticed this bump pushing against the right side of my nose that prompted me to finally go see a doctor. And over the course of about 8 weeks of doctor visits and a biopsy, I finally got the diagnosis that what I had was a rare form of cancer called a fibrosarcoma. And I was very fortunate that I got the right diagnosis because so many sarcoma patients don't, at least not initially. But I was even more blessed that I was then referred to my new surgeon at UC San Francisco, Dr. Roger Crumley. And right off the bat, I liked this guy, right? He was just a good guy. There was a good chemistry fit. We understood each other. And he did a thorough exam, and he studied the history on my case and determined that the best way to treat my condition was with surgery and surgery only. So he went up through the roof of my mouth and along the wing of my nose to remove that remaining malignancy. And it really wasn't that big of a deal. It's about a 4-hour operation. I ended up with a few stitches inside my mouth, a few along the wing of my nose, released from the hospital the next day. And I went back to my classes at Cal looking like I had been in a fight with someone, but not something. And I pretty quickly fell back into my old ways, right? I was 21 years old. I was invincible. we're all invincible at 21, right? But about 6 months later, I began to feel tingling sensations in my cheek. It kind of felt like ants were crawling through my skin, and I just wanted to rip my cheek out because it itched so bad. So I made an appointment to go back and see my doctor. And at that point, he was pretty certain it was a recurrence. So he scheduled me for another operation. And I ended up having a 10.5 hour procedure at that point that resulted in the removal of half of my nose, the shelf of my right eye, the muscle and the bone for my right cheek, part of my upper lip, part of my hard palate, and 6 of my teeth. And I woke up attached to my chest like you're seeing here because they had to transplant this full thickness skin graft from my chest to fill in this cavity that had been created on my face. And so when I was able to get out of bed and walk around the hospital, I did, and I kind of shuffled around, and everyone looked at me like I was some kind of a freak, which I guess I was, but I did it anyway. And at that point, the doctor told me something that I'll never forget. He said, Terry, I'm going to make you streetable before you leave the hospital. And I didn't even think to ask what streetable might have meant. So I made some assumptions in my own mind. The first thing I thought of was acceptable. And then the next thing I thought of actually was Tom Berenger in this movie Platoon that came out right at that time. And in the movie, Tom Berenger had this big keloid scar across his cheek from this knife wound that he'd received in battle. And I thought, hey, maybe that's what streetable looks like. And if that's streetable, that's not so bad. I can live with that. In fact, a lot of girls kind of like that tough guy image. It might actually pay off for me. But his definition was very different than that. He was preparing me for this life of disfigurement. So I ended up having 2 more procedures to remove the remaining malignancy, and then I was released from the hospital. And it was really at that point that I began to realize the severity of the situation, right? Because inside of a hospital, you're very protected, you're very insulated. Outside of it, very vulnerable, very exposed. And that's when I began to notice for the first time when I went to the public part of the hospital and leaving my private room. That's when I began to notice for the first time people staring at me. I noticed little kids kind of with their parents walking along, pointing at me and whispering. They were curious. They were asking questions. I remember also seeing a group of young boys and girls giggling at me from a safe distance, of course. And I just wanted to start that reconstructive process as soon as I could, but I wasn't able to because I had to wait for everything to heal. I had to wait for radiation therapy, which I had. I had about 6,000 rads, followed by 48 hours of these iridium seed implants they put inside of my denture or my obturator, where they cordoned me off in a room at the cancer ward at UC San Francisco with yellow warning tape across my door because I was radioactive. But really what became ever more difficult for me in my recovery was the aftermath of my cancer. It was a disfigurement that resulted from it. And so over the next 5 to 6 years, I had another 25 procedures, and most of those were reconstructive in nature. And it really took that long for me to become content with who I was as a person, but it took a whole series of events to get me there. And a lot of people ask me, what sustained you through this process, right? And I'd really attribute it to 2 key things: to the people that I interacted with during that time and to some events that transpired. But first and foremost, it really was my family and my friends who were incredibly supportive, caring, nurturing, committed. But mostly, the most important thing was that they were full of positive energy. It was my medical team. My doctor was an incredibly confident and competent man who never expressed doubt that he'd get me cured of my cancer. He never expressed doubt that he would get me reconstructed back to that old Terry. And regardless of whatever the final outcome was, the fact that I trusted my doctor really enabled me to keep hope throughout the process. But then there was this whole series of events that really liberated me. And the first was meeting a girl named Dina. So this is 4 years after that major procedure that I showed you earlier. And Dina and I met and we started to date. And early into the relationship, we went away for a weekend. At the end of that weekend, though, Dina just looked at me and she said, Terry, you have a lot of issues that I can't help you with. And you need constant reassurance, and I can't give you that. And what she taught me really was that the scars on the inside had become far more disfiguring than the scars ever were on the outside. It really wasn't my physical appearance that was my issue, right? It was my person that was my issue. And granted, that was a devastating moment, but it was also liberating in the sense that it started to put things into perspective for me. And suddenly I began to realize for the first time that I didn't need to figure out any longer who that next wizard surgeon was going to be, who was going to fix my nose or fix my eye or fix my lip. Instead, I had to focus on rebuilding what was inside. But, don't get me wrong. When she spoke those words to me, it was difficult to hear. It hurt. It was painful. But you know what? I processed that. Over time, I reflected on what she said, and over time, I became grateful for what she said because she set me on a new path. And so instead of searching for the next wizard surgeon, I began to search for a support group. And eventually I came across the cancer support community. Many of you may know about the cancer support community. It's a national nonprofit dedicated to providing support for cancer patients and their families. And as I went to these weekly support group meetings, I began to realize over time that I actually had an inspirational story to share with other cancer patients. And that in turn helped me to begin to feel better about myself so that now I could start to take 2 steps forward, 1 step back instead of the other way around. But the most important thing that it enabled me to do by going to these group meetings, it really enabled me to find the courage to share my vulnerabilities. And that was liberating. And finally, and probably most importantly, it was meeting my wife, Sue. And this is definitely the most significant turning point was meeting my wife, Sue. We had 2 dates together before the topic of what happened even came up in the conversation. So that told me a lot about Sue. She really wasn't concerned about whatever happened to me, but she cared about who I was as a person. And that really was the most significant turning point because she accepted me for who I was and to this day has never asked me to change. In fact, I wake up every morning and let me tell you, I'm a scary, scary sight in the morning, right? I have a few hairs sticking up on the top of my head. My nose is crooked. My eyes droop. My lip is pulled up. Most mornings, I don't even have my teeth in my mouth. But you know what? She smiles back at me and kisses me back, unless my breath is absolutely heinous. And never once in all these 30 plus years has she ever looked back at me and said, Terry, maybe you ought to think about getting your nose straightened out a tad or get your eye lifted because I could do that if I really wanted to. She's never said that. Now, the fact that she's been teasing me for the last 10 years or so about going bald is a whole nother issue. But as I always say, somebody in life has to keep you grounded, right? But really, the point in me telling you some of these stories is that all of us need to be aware, alert, attentive, and open to the people that we interact with and to the events that are transpiring around us because they can and they will impact us. And none of us knows where we're going to get the inspiration that we need to help us to get through a crisis in our own lives. Finally, on this last slide, I just wrote a new book called The Resilience Mindset. In that book, I share a lot about how to build resilience and gain confidence. The book on the right is my memoir about my personal story. And over on the left is my website address. These books are available on Amazon, at any bookstore, or on my website. And again, I want to thank everybody for listening today, and I'm grateful for my experience.
Terry, what a remarkable journey and really an inspiration. Thank you for sharing your journey. I do want to remind everyone to please use the chat and the Q&A box to ask questions. We'll discuss them at the end. Our next speaker, Dr. Evan Graboyes, he's a professor in the Department of Otolaryngology, Head and Neck Surgery, and Public Health Sciences, and serves as the Director of Survivorship and Cancer Outcomes Research at the Hollings Cancer Center, Medical University of South Carolina. In his clinical practice, he routinely cares for patients navigating the complex cancer care system during treatment and supports them in coping with mental health challenges that can arise during the survivorship period. Dr. Graboyes has done tremendous work and research in this field, and I look forward to hearing his talk.
Thank you, Dr. Patel. Thank you to the Head and Neck Cancer Alliance for this really phenomenal opportunity to reach an important audience and to elevate this topic within the survivorship community. I think if sometimes after a really phenomenal first act of a webinar, you say it's a tough act to follow, I would say Terry is a beautiful act to follow. I heard a couple of times during the practice this set of remarks from him, and they're even more impactful today in real life. And I think hearing his struggle really sets up my talk, which is, I think, having people like Terry in my clinical practice got me excited about this topic as a head and neck reconstructive surgeon. And I would say that she may not have known it at the time, but I think Dina and Sue really laid the foundation for the way in which we've learned to best support head and neck cancer survivors like Terry going through these challenges. So body image distress, abbreviated here as BID in this set of talks, is relatively common. And I think within the head and neck community, this may seem obvious, but to the outside world, maybe not. And head and neck cancer arises in really cosmetically and functionally critical areas. And as a result of the cancer and its treatment, head and neck cancer survivors experience substantial and life-altering morbidity. Things like facial disfigurement, like you heard from Terry, difficulty swallowing, impaired smiling, challenges speaking. And these changes to the body happen in highly visible and socially significant areas. So these aren't parts of the body that you can just cover up with clothes or keep sort of hidden, but really what makes us, in essence, human and really defines our self-identity and key social and interpersonal relationships. As a result of these impactful changes to the body, about 3 in 4 head and neck cancer survivors express body image concerns. And by our best estimates, approximately 1 in 4 head and neck cancer survivors, those concerns become so important that we would say they're clinically significant. I think just as a terminological note moving forward, on some level, body image seems like it's about aesthetics. I think especially for head and neck cancer survivors and where these changes happen, it's important to distinguish that body image concerns is not the same thing as clinician-rated disfigurement. This is a very important functional aspect to body image that head and neck cancer survivors have told us is important. And that's sort of not only how does their body look, but what does their body do for them for things like smiling, talking, chewing, eating. And so here's some research that our team led a couple of years back on the horizontal axis. So the points going across here is a validated clinician-rated measure of disfigurement. So these patients, the clinicians asked them to say on a score of 0 to 10, how disfigured were they? And on the y-axis, this up-down axis here, to the panelists, BID is body image distress. Sorry, I mentioned on the first slide. So a way to describe the concepts that Terry was explaining his initial slides. So on the y-axis, the up-down axis here, we have a patient-reported measure of body image distress that's specifically for head and neck cancer survivors. And the whole point of this graph here is to say that for any given level of clinician-rated disfigurement, patients experience a wide range of body image distress. And so that just means that if we're trying to help head and neck cancer survivors with these concerns, we cannot just ask clinicians to say, oh, this person looks disfigured, this person does not. We really need to harness the patient's voice. And so one of the first things I think our team established was that body image distress, these concerns we heard about from Terry, really have no relationship to how clinicians would rate the disfigurement of their head and neck cancer survivors. And therefore, if we want to help identify these patients in clinic, we need to make sure that we actually talk to patients and harness their voice to understand their concerns, not rely on clinicians to rate who they think should benefit from therapy. So to help harness the patient's voice, we developed a head and neck cancer survivor specific patient-reported outcome measure. I imagine many of you have seen tools like this used in clinical practice when you go back to see your head and neck surgeons, where they ask you to sort of like rate different items, maybe about like depression or pain or things like that. Swallowing challenges maybe are common. So this is one that was specifically about how head and neck cancer has changed people's bodies. And so I think you heard some comments from Terry that sort of echoed the way these questions are written about maybe the way comments other people may make about the way they look, or being embarrassed about eating in front of people, or social situations where children and strangers are staring. So this gives the clinician a chance to really understand from the patient's perspective in a validated way how important these body image concerns are to them. So to help head and neck cancer survivors with body image distress, I think we heard from Terry really the importance of social support, and then maybe support groups. But I'd also say we heard in his comments from Dina about the idea that he has scars on the outside, but really the path forward was not finding some wizard reconstructive surgeon, but learning how to heal on the inside. And that's really the essence of this intervention that our team developed called BRIGHT, or Building a Renewed Image After Head and Neck Cancer Treatment. So it uses a very commonly employed form of psychotherapy called cognitive behavioral therapy. And the BRIGHT program has patients matched up one-on-one with a mental health professional to get weekly telemedicine-based sessions once a week for 6 weeks. And the core concepts of BRIGHT are to help sort of unhelp head and neck cancer survivors identify and correct unhelpful automatic thoughts. These would be things like everyone's staring at me, or someone notices I'm drooling, or things that your brain sort of races to conclusions. And then to help maybe unwind some maladaptive body image coping skills that have developed over time. There's 6 different topics shown here that sort of walk head and neck cancer survivors with the mental health professionals through these sessions week after week, including all the way up to week 6, where we start to think ahead and plan for potential setbacks down the road. The BRIGHT program is guided by a patient workbook, and we had a lot of phenomenal patient input to create and refine this workbook. Here's some examples here that sort of is the basis of psychoeducation and this important relationships between thought patients may have, behaviors that they may lead to, feelings, and this really important triadic structure. The workbook also allows patients an opportunity to reflect in session. So here, again, things you heard about from Terry, the importance of social support and communication, and then potentially maladaptive avoidance behaviors that seem to shield patients at the time, but really lead to long-term coping challenges. Therapy is once a week for 6 weeks, which means there are many, many, many hours of the day in which the head and neck cancer survivor is not with a therapist, as there's an opportunity to practice and refine these skills in the form of homework. So here's some examples of what homework may look like that's done in between sessions. And I think we are fortunate to have, I know Angie's on the call and hopefully Brad is as well, 2 amazing Head and Neck Cancer Alliance ambassadors who have been integrally involved in this program from the very beginning, all the way from helping develop BRIGHT to sort of think about like when should it be given to patients after treatment, what's the modality, how many sequences should it have, what kind of content we should put in. They show up to all of our monthly research team meetings. They're co-authors on our papers, and they've helped us not only develop but refine and then now share BRIGHT with you all. So after we developed BRIGHT, we then tested it in a clinical trial, and we enrolled 44 head and neck cancer survivors with clinically significant body image distress. And I won't walk you through the details of this graph in gory detail, but yellow bars represent patients in BRIGHT, blue represents patients in the control, so the comparison condition. When the bars are going down, that means patients are getting better in terms of body image distress. And so what you can see here is that nearly all of the yellow bars are going down, and that means patients' body image distress is getting lower. If we wanted to put some statistical numbers on this, what we would say is that patients who were in the BRIGHT intervention were nearly 7 times more likely to have a clinically meaningful improvement in their body image distress relative to patients who got dose and delivery match control conditions. So meeting with a therapist, hearing them talk empathically, but not getting sort of the magic sauce of BRIGHT that we think is so important. In addition to improving body image distress, the BRIGHT intervention also decreased depression in head and neck cancer survivors and improved their head and neck cancer-related shame and stigma. So based on that clinical trial that was conducted at our institution, the Medical University of South Carolina, we have now scaled BRIGHT nationwide and are in year 4 of an ongoing multi-center randomized clinical trial with over 200 head and neck cancer survivors who are receiving either BRIGHT or that same attention control condition. We follow them up to 9 months to see if those improvements in body image are sustainable. And then very importantly, are studying how to move this from the research setting into clinical care so that it can be available to all head and neck cancer survivors and not just those in research studies. I think stay tuned for that. We'll hopefully be able to share this data with the field in the future. And thank you, I think, to all the many collaborators on this team, Patients with Cancer, the Head and Neck Cancer Alliance, and then particularly Angie and Brad. So thank you for being here.
Dr. Graboyes, Thank you for leading the field in such an important topic and sharing this. Just as a reminder, some of the resources that Dr. Graboyes talked about, the Bright Handbook is available through the Head and Neck Cancer Alliance website. And a reminder to please use our chat and Q&A box for questions, and there will be a survey at the end to provide feedback for the webinar. Our next speaker, Lynn Kim, she's a fellow healthcare professional here at City of Hope with me. She's an occupational therapy manager in our Department of Rehabilitation Services. She specializes in cancer rehab and is dedicated to providing high-quality occupational therapy that improves the quality of life for individuals living with cancer. Lynn has presented locally, nationally, and internationally on topics such as sexuality, psychosocial care, and lifestyle management within oncology occupational therapy practice. Lynn, take it away.
Thank you so much for the intro, Dr. Patel. Hello, everyone. Good day. My name is Lynn Kim. I'm an occupational therapist and manager of the OT department here at City of Hope. We're located in Doherty, California, which is about 20 miles east of Los Angeles. But yes, it's a privilege and a pleasure to be able to speak to you all today about this topic, which is near and dear to my heart. But when we think about recovery, we often focus on survival, function, medical outcomes. But for many survivors, one of the most difficult parts of recovery is just learning how to live in that body that no longer looks or feels or functions the way that it used to. So there's some of the challenges you might experience. Well, basically, why does body image matter? These are some of the questions that some of my patients have actually brought to me. It's like, I should just be grateful that I lived. I can't believe I'm in here complaining about my body image. Why are we all talking about this topic on a Tuesday afternoon? Well, body image is not just about vanity. It's about how we experience ourselves in the world. And for individuals with head and neck cancer, the treatment oftentimes it's above the gown, right? Most of the time it's above the gown. The treatment can result in very visible and personal changes, which may affect how you feel about yourself or see yourself, how you think others see you, whether or not you feel comfortable engaging in everyday life, like returning to work or school or going to the grocery store, having a relationship, socializing with others, right? And in my clinical work, my patients commonly describe three challenges. So the first of which is here, distress due to appearance changes. So this might be discomfort with scars or swelling or lymphedema, weakness, changes in symmetry, right? The second is visibility of functional difficulties. And what I mean by this is altered speech, difficulty or inability to swallow, difficulty managing secretions, maybe drooling or even dry mouth, needing adaptive equipment, right? So all of these things, they may attract unwanted attention, especially when you're out in public. And sometimes you just don't even want that attention. Maybe you want the attention more of the content of your conversation or what you're wearing, right? Versus a functional difficulty. The third is disruption of identity. So many of my patients come in and just tell me, like, Lynn, I don't recognize myself anymore, or I don't feel like the same person I was before cancer, or I'm worried that people will question my intellect because of how I talk now or how I look now, right? These are some of the things that my patients tell me in clinic. And what's important to understand is that body image distress, or BID, as Dr. Graboyes identified, is that distress does not correlate with clinical severity. What that means is a change that might seem minor to providers, like minor in big air quotes, minor as in, oh, it's just a 3-inch scar. It's not that bad, right? That's such a subjective statement that can feel very overwhelming to a patient, especially when that 3-inch scar is right across your face, right? At that point, I think when the distress starts impacting your ability to do things in your everyday, that's when it becomes more larger than an emotional issue. It becomes a participation and a quality of life issue. Oops. So as an occupational therapist, if you've ever been touched by an OT, you'll know what our services are about. If you haven't heard of us, well, I focus in a little niche area here. But my research and my specialty is in cancer rehab. But as your OT, my goals are to really just analyze who you are in the intersection of person or you within your environment in the occupation that you want to do. Occupation is just a fancy word for an activity that occupies your time, right? So who are you? What environment are you in? And what activity do you want to do or you need to do, right? There's a little bit of a difference there. Some things you really want to do, some things you just like have to because life goes on. And through that occupational engagement or through the act of being involved in those activities, we're building confidence. Confidence doesn't build through avoidance. It's really easy to avoid things sometimes, as you saw in that graph that Dr. Graboyes brought up. Avoiding something uncomfortable may result in very short-term comfort, where you're like, I don't have to be uncomfy for that second there, but long-term, it doesn't quite serve you. So how do we build your confidence over time? And we want to do this by addressing some spheres in life, like your self-care, your social participation, intimacy and sex, work and school. These are very big areas of life. And we do this in a very simple way. It really just boils down to implementing simple, practical habits and routines that support not only your body, but your mind. As Terry mentioned, it's not just physical, right? It's what's going on inside up here and in here. So movement. Being in rehab, obviously, we love to talk about movement. We as in OTs and PTs, but we love talking about movement. However, movement can look a little bit difficult when things don't quite move the same. But treatment, as in cancer, radiation, hormone therapy, whatever you're getting, surgery, obviously, chemo, the treatments may cause fatigue, pain, weakness, changes in your balance, shortness of breath, right? And some of these symptoms are temporary, some might be permanent, and these may lead to deconditioning over time or weakening over time. It can also result in a loss or decline in confidence and, unfortunately, a lower quality of life for many individuals. So we know about the benefits of movement. I think we all in the room know, yes, everybody has told me that physical activity is very important for my health. Your primary care physician has likely told you this at some point. But I usually ask, what is the ideal physical activity for people? Is it walking? Is it weightlifting? Is it Pilates or yoga? Is it marathon running? Is it swimming? What is it, right? Well, the answer is your best movement activity is the one that you will actually do consistently and routinely. And that's going to look different for everybody in the room. So you need to find what you will actually do, because that will be the best movement for you. And your environment, it is cold outside. I'm in California, so it's 76 degrees outside, so I'm very spoiled, but I recognize there's parts in the country that are not 76 degrees right now. So finding what environment works best, what is feasible for that movement that you want to do, and you within that environment, right? And as you are exploring what works for you and building that up over time, you're also rebuilding your body trust. So I think with cancer treatment, a lot of that control over your body is stripped away from you, or can be temporarily or even permanently, through the treatments some of these treatments that we do to save y'all's lives can be quite radical, right? And some of that control can be taken away. And rebuilding that body trust, like even something you didn't even have to think twice about before, like swallowing or blinking or breathing, right? Some of these things, moving your body and just walking around, it takes time to rebuild the body trust, and you can only do that through trying. Avoiding it and not doing it likely will result in more weakening of those muscles that should be helping you. As you're doing these movements, it also helps to boost your sense of agency and regaining that control over the situation, over yourself, builds your confidence. And paradoxically, I know it seems like a paradox, but it actually helps to reduce the symptom burden of fatigue too. It's like, yeah, but Lynn, exercise makes me so tired. What do you mean it cures my fatigue? Well, when we're looking at long-term studies, one of the number one benefits of movement activity and for boosting body image actually is exercise, because it helps to condition your body and reduces the long-term impact of fatigue. Next is socializing and reconnecting. And I know this can be a little bit difficult if we're not feeling quite ourselves, but treatments can result in changes in speech, secretion management, speech and swallow, your appearance, and this can lead to social avoidance, isolation, loss of connection with yourself and with others, anxiety and depression, social anxiety, right? A loss of self-confidence or self-esteem. I think some helpful ways to tackle this is just take spontaneity out of the picture and plan ahead. So if there's any planners in the room, now is your time to shine. If you're not a planner, I think get out a notebook and start planning, but planning responses to questions. Yeah, I think there was a question in chat earlier about how do you respond to people who approach you in the community. I think Terry had a good answer to that in the chat. But, addressing it, sometimes it helps to address those questions with humor. Others can be more boundary setting, where you tell the person like, yeah, I've been through a lot. Any other questions? I'm happy to answer anything else, but not comfortable answering that right now. Or, can even answer with humor, like, ooh, major surgery, very dramatic, very expensive. Next, let's talk about something else. You can kind of come up with your responses to those questions, but taking spontaneity out of the picture and rehearsing some of those questions can be helpful. So you can kind of keep that in your back pocket. Choosing environments that you feel safe. These can help you set you up for success. So, for example, I was problem solving with an individual recently, and they were going to meet up with a friend. And certain environments don't set you up for success, even if you haven't been through head and neck cancer. For example, trying to have a conversation in a noisy restaurant or a bar, can't even hear half the things that the people across the table are saying, whether or not you've had cancer treatment, right? Now you go to the same environment and perhaps your speech is affected, perhaps your hearing is even affected, and then you go to the same environment. It's just that much harder. Maybe don't choose that noisy bar or restaurant for that meetup with a friend. Maybe choose a quieter environment, right? Even some outdoor areas can be a little bit kind of triggering of like a cough or anything like that for individuals who don't do well with like fumes from cars and things. So just set up, choose an environment that feels safe to you and that really sets you up for success. If you're experiencing any anxiety or stress while you're socializing, using some simple relaxation techniques to help self-soothe can be helpful. So even just holding something tactile, for example, even just like holding onto something like a pencil or whatever in your hand, a worry stone in your pocket, perhaps a fidget, even just some simple self-soothing. If you kind of, I think a very natural response is when people get nervous, you'll see people kind of wringing their hands. That's a very natural response to your body just looking for that proprioception. And it just has become this universal sign of nervousness. But truly, it is a way that people will just naturally try to put pressure through their joints and find that proprioception to calm themselves down. But figuring out what works for you. And then identifying members of your support system who can really help you through some of these challenges so that you don't have to go through it all alone. So we talked about occupational engagement and how participating in life activities is truly health restoring, and it's essential for recovery. Basically, it's, why are we even going through these cancer treatments? Yes, of course, we want to increase the quantity of life, but we can't forget about the quality, right? We want to identify valued activities. What are your valued roles? Your role as a grandmother, grandfather, as a spouse, as a child to somebody, as a worker, a teacher, a professor, a speaker, whatever it may be. Maybe even just being a functioning person in society. Just want to be a normal person in society again, right? Like, what are these valued things that you want to do with your life and the time that you have earned, right? Address the barriers just head on. So physically, what's going on? emotionally. We talked about that. And then environmentally. If you need to go back to engaging in these things more gradually, you can kind of grade it. So you want to dip one toe in the water and then the whole foot and then your whole and then their leg, and then now you're kind of wading through the water, right? Kind of just gradually getting back to those activities slowly. Others just choose to jump off the deep end and figure it out. It really just depends on what works best for you. But I like to set SMART goals, or small, measurable, realistic goals. And if there's anything, you leave my talk with today, it's what can I do for myself today, this evening? What can I do for myself today? And if you've already done something, then like wonderful. I think just showing up to this webinar is like amazing enough. But what can you achieve for yourself that is health restoring today that will boost you? And when you get that, celebrate your wins, no matter how big or small, because that will light up that reward center in your brain. It's going to motivate you to do the next best thing. Oops. So adapting and accepting. So some quote unquote normal routines before treatment, they may look a little bit different now, and that's okay. Meal times may look different if you have to eat different textures, perhaps can't quite eat at all anymore. Perhaps eating just looks a little bit different. You might not be able to eat the same foods that your family's eating. Maybe socializing may look a little bit different in the environment or how you socialize. You might have to repeat yourself more times than before. Sex and intimacy might look a little bit different, like with kissing or anything like that. Self-care routines may look different if you have to invest a little bit more time into certain aspects of your health management on a day-to-day basis. More of your time may be spent at hospital visits or with medication management. But these routines that you kind of adopt, they become routines when you do them more routinely, right? In the beginning, they're not routine because you're learning so many new things like all at the same time. And then over time, as the adjustment happens, those routines become routine because you're doing them so routinely. Yeah. Same with physical activity, and same with any activities that help boost your self-confidence and reduce your stress and anxiety. The more routinely you do those activities, the more chance that it'll become a routine for you. Adapting may be necessary if in order to maximize your function. And what that means is just things maybe have to be done a little bit differently than before. And that's okay, because whatever helps you to do that task, we got to do what we got to do. So in closing, I kind of want to leave you with a couple words, but there's so much focus after head and neck cancer about what goes on the outside. And Terry touched on this, Dr. Graboyes touched on this. The scars, the asymmetry, the things that might feel unfamiliar when you look in the mirror, your literal appearance, how you feel, those are all very valid. I think grieving that, feeling frustrated, even anger, that all has a space. And I think what also deserves space is that the body that carried you through those treatments and is continuing to carry you, it endured something incredibly hard, and it endured these crazy treatments that didn't exist even years before, right? It healed, it adapted, and it kept going, even on the days that you really thought you couldn't even get out of bed. So confidence doesn't come from pretending like nothing happened. Confidence comes from saying, this happened and I am here and I'm choosing to live the life that I want to live. So body image after cancer, it's not about learning to love everything about yourself overnight, because when does that actually happen? I don't know. I think when you've reached that level of transcendence, like that's amazing. But body image after cancer, it's not about just learning to love everything overnight. Sometimes it's just about learning to respect and have gratitude for what you've been through, and just making this decision to choose not to be at war with your own mind and your own body. So just remember that your strengths, your presence, and your life matter. And that survivorship is not simply about being alive. It's also about being able to participate in life the way that you authentically want to. Thank you. Here are some other resources.
Lynn, thank you for everything that you do with our patients and the message that you had in closing. It's phenomenal and very inspiring. So thank you very much. I just want to remind everyone, please use the chat Q&A function to ask us any questions. And there will be a link for a survey at the end. We want to hear and receive feedback on this important topic. And finally, the video will be available through the Alliance website. Looks like there's a few questions rolling in. Let me ask you, Terry, if we can, and based on your experience, and you've got such a wonderful support system, but there are a lot of caregivers and partners on the call, and maybe if you can share, perhaps how can caregivers and partners offer support to the survivors without trying to fix or minimize how the survivor feels. Terry first, and then I'll open it to Dr.
Okay.
Graboyes, Lynn.
Yeah, thanks, Dr. Patel. I mean, I would say that, at least from my perspective, it's really about being there for the people. It's about your presence. It's more about that than anything else. If I look back on my experience, I think I noticed people struggled. They didn't know what to do. They didn't know what to say. People haven't been through dealing with something like this before, right? People don't have a lot of experience. And so my greatest memories were waking up in my hospital bed and just seeing somebody sitting there smiling at me. And so just knowing they were there to support me however I needed them to was great. On the other hand, I would say going to support groups was also incredibly beneficial to me because in some ways that was more powerful as a support mechanism because the people around you will always say you're great, you're doing wonderful, you're strong, all those things, right? Which is great to hear, but sometimes it's nice to be with people in a support group environment that might really understand exactly what you're going through because they're experiencing it themselves. And so you start to share your vulnerabilities. And I'll tell you, that was, as I said in my presentation, incredibly liberating, I think.
That's great. Lynn, your thoughts?
Yeah. Some of my advice too is for caregivers or for spouses who become caregivers, that can be a quite tricky dynamic because so it's like, when do I get to be the spouse again? But the caregivers, it's their first time going through this experience too. And sometimes when I have sessions together with patients and caregivers, I tell them like, I know you guys have been married for 50 years, but trust me when I tell you, you cannot read each other's minds, especially right now. Communication is key. I think if you have somebody who can help facilitate a conversation, I would, for example, we have a social work team who runs a couples program here. If there's resources in the community who can help with that, I'd highly recommend reaching out to that. But can't read each other's minds. So we have to just be straightforward with communication. I think tackling it head on can be helpful a lot of the time. Yeah.
Dr. Graboyes, in your practice, how do you approach this topic? It's this is something that is so important, and yet it's not as easily explored in clinic visits by the clinical team and the surgeons. And so, how do you bring that up with their patients? What's your discussion like? If you can share a few words, if there are any other surgeons on the webinar, they may learn from that.
Yeah, or by all means, I'm happy to have them chime in and offer their thoughts on how it's done. So I think the arc of change is slow. And I think just like Terry had a mindset that like, oh, if I just find one more wizard surgeon, like that will solve my problems. I think surgeons have that same wizard mindset, which is like, oh, if I just do one more wizard surgery, like I'll solve that problem. And I think it's through the scientific process, the webinars, I think the training that hopefully the future generation of surgeons, I think just like the group of clinicians now, like all recognize generally that it's not that people need to just be grateful to be alive, but there's much more to survivorship than being cancer-free, but also the components of psychosocial well-being and thriving. And I think head and neck cancer is I would say the most relevant, but one in which like these body image concerns are incredibly relevant. It's better studied in breast. We're getting there in head and neck. But I think that the culture change within the surgical community is going to be key moving forward. So I think in my practice, I guess I would say one, I normalize that it's not about appearance. Like we heard from Terry and Lynn, it's not a vanity situation. So much of what drives body image concerns are about function and what function means for social interaction. Two, that it's relatively common. It's not everyone. There's certainly many people in our practice who don't have these concerns, but for the ones where they do exist, they are really impactful. So I think helping identify who those people are and recognizing you can't just tell by looking at them. I think also like we heard from Lynn and Terry, and then having really close collaborations with our mental health colleagues and sort of knowing how to get people in and then having them have some expertise to deliver the care to these patients the right way would be, I think, the key parts, and then helping trainees be ready for the future.
Yeah, great. I can speak for myself. I believe, patients and family members are the biggest educators for me. And so I would highly, highly encourage patients and caregivers on the call to bring up these concerns to their clinical team, to their surgeons, radiation oncologists, medical oncologists, other allied healthcare workers. And it's one step at a time. I believe. So, great. Let's see what other questions we have. This is a very pertinent one, and I'll start with Terry again because, again, you were quite young as you kind of shared your story and the journey when you were first diagnosed and the cancer treatments and how it evolved over time. So, and you partly shared amongst your talk, but what do you think the approach or the engagement is, and does it vary based on the survivor's age? We assume that it does, but would love to hear the panel's thoughts on that. And
The
go ahead.
approach on what? On how?
I think the BID or the image and how does that evolve over time? Younger patients versus somebody who's in their 30s and 40s compared to 60s and 70s.
Yeah, so in some ways, my age was a very interesting point to be in, being 20 years old, because that's when appearances matter so much. It's like when you're spending your life consumed by dating. Many people are anyway. I know I was. On the same token, I went into that experience of having a facial difference, disfigurement, however we want to define it, as coming in, and that's why I shared these slides in the beginning, is coming in as somebody who actually had a lot of self-confidence. So I always felt like I had that benefit, and I have gratitude for that because maybe that gave me a little bit of help along the way, that I knew I could get it back somehow. I didn't know how, but I kind of believed I had hope. I think and so every age group, it's very different, right? I mean, I'm empathetic, but I don't know what it would be like to be born or grow up and experience that at a much younger age. And that would be very difficult to the way people get bullied and all that kind of stuff through school. Honestly, in some ways, I'm just grateful it happened when it did for me, because when I look at older people in their 30s and 40s, who I was in support groups with Dr. Patel, what I learned in those support groups was their concerns were very different than mine. Certainly they had concerns same as mine, but they were also responsible for their household. They had financial concerns. They had those kind of things, which didn't even cross my mind because I was 20 years old and I was just going to school. I didn't need any money really to get through school. So those are just a few thoughts, but at the end of the day, I'm grateful that it worked out the way it did, and I wouldn't trade my experience for anything.
Dr. Graboyes, what's in your bright study and amongst sort of the early work that you've done, have you noticed differences in age?
Yeah, Terry's answer was so good for so many reasons. So I think one of the early studies we led was to try and understand, I think, risk factors for body image distress in head and neck cancer survivor population. I think there was some thought maybe in the field that this is sort of a concern that's more prevalent, more common in women than men and younger people than older adults. And our work would not substantiate either of those things. So I think equally common in men and women and equally common in younger and older adults. And when we look at all of the sort of like demographic and clinical factors that seem to be associated with body image distress, that explains about 20% of the person-to-person variability, which means we don't understand 80% of it. And that 80% is all the things that aren't age that you sort of like heard about in Terry's story and Lynn's story. And I think return to work is a very real and important consideration for some of the not younger adults who have this. And there's definitely strong links between unemployment and disability and higher levels of body image distress. So yeah, I think it's something that can affect everyone. And that's another thing I think for clinicians to be aware of in their clinic, that they don't let their sort of prejudices or non-data driven stereotypes limit who they screen for and refer for treatment.
Right. Lynn, we have a few minutes remaining, so let me ask one closing question to all three of you. And what is one small realistic step that someone could take this week to be gentler with their body or rebuild their confidence? Lynn first, Evan, and then we'll close off with Terry.
Yeah, thank you for starting with me. I'm gonna have to think about that for one more second. I want to make sure it's a good answer, but I think some of the work I do in my clinic is if there's any areas of your body that, and this goes for all of us, but if there's any areas of your face or body that, are providing you with discomfort or that you're not quite there yet with that part, I'd say just touch it, put your hand over that area and just give yourself that positive affirmation. This is some of the work I do in my clinic where you're giving yourself some of that positive self-talk. You want to redirect some of that positive energy inwards. You don't have to give yourself a brave face, but say that inwards, give yourself that positive affirmation and that gratitude for your body for sticking it through.
That is such a good point. Your point about the proprioception, I think subconsciously we all do it. At least I do anyway as a surgeon. But that point can be applicable in many different scenarios. Dr. Graboyes, what's your one message that you would want to pass along that patients and caregivers can try?
Yeah, I love Lynn's answer, and I loved the idea of setting SMART goals. And I think sort of step one of Bright, in addition to describing what body image distress is the psychoeducation around the relationship between thoughts, behaviors, and emotions. So one of the first things we ask patients to do is just be conscious and mindful about when body image type thoughts enter their brain and what are those social situations and what triggers them. And so I think before you can work to potentially modify those thoughts and behaviors, you need to at least be aware of them. And often those things are happening at a subconscious or not conscious level. So I think mindfulness of those body image thoughts is a critical first step.
Great. Terry?
Yeah, God, there's so many things swimming in my mind. And I think Evan and Lynn had some great answers too. I would say that, if you ever struggle with attitude, start with gratitude. I always say that because it changes your mindset. It really does. And Lynn, you referred to this too. I also like a lot what Lynn said in her presentation about no need for lofty goals. I wrote that down because I talk a lot about when you have too many priorities, you don't have any, right? And so you really need to hone in on something that's achievable, because when you can focus on something like that, it really builds confidence in just that act alone. And then as you achieve it, you start to believe in yourself. Other real quick things I'd touch on is positive imaging and visualization. Golden to me, life-changing in so many ways, just very simple exercise that anybody can do. So those are just a few things.
Excellent. On your message of gratitude, I'm grateful to all three of you to be sharing your work, your journey, your stories, and this webinar put together by the Head and Neck Cancer Alliance and the American Head and Neck Surgery Society, Head and Neck Society. This, as I said, this is our first time hosting this topic. We would love to get feedback on this topic. Please use our survey link to provide that feedback. This webinar will be available on the Head and Neck Cancer Alliance. And finally, the Alliance has excellent support group. There are some links in the chat that Melissa and Eileen have put in there. If anybody needs to connect with the support group, very grateful to the ambassadors of the Alliance as well. Thank you very much, all.